Thank you so much, Dr. Carlton, for joining me today to talk about anal fissures of all the things.
I know, so sexy.
Oh, so sexy. Sexy things apparently lead to them.
Yeah, you can.
I first wanted to ask you so that you can tell everyone what a GI doctor even is, because I don't think a lot of people even know what a GI doctor is or what they do.
Right, I'm a GI doctor is a gastroenterologist. I do the entire gastrointestinal tract from the mouth down to the anus. So I do things like endoscopies, colonoscopies, remove colon polyps, prevent colon cancer, look for stomach ulcers, but even other things in the internal side of the abdomen, like pancreas and liver and stuff like that. I'm the medical side of things. The surgical side of things, for what I would do, would be a colorectal surgeon. So if anything needs to be operated on, that's who I would send my patient to. But usually we try to do things medically first to get diagnostics before we send someone to a surgeon. It takes 14 years after high school to be a gastroenterologist. So I did. I know, right?
It takes 14 days to be a hooker on Instagram. You need to pivot. I talk about hemorrhoids all the time on my channel. So
Right.
what is an anal fissure and what is the difference between a hemorrhoid and an anal fissure?
The hemorrhoids are basically inflamed internal and external hemorrhoidal veins. You have normal veins called the internal and external hemorrhoidal veins that encircle the diaphragm, basically. Externally, your external hemorrhoidal veins, internally the internal hemorrhoidal veins. Those are there for circulation purposes, to take away blood that's been used by your body to back up to your heart, get reoxygenated through your lungs, and then sent back out to the arteries. So when those become ballooned out or inflamed, that's what a hemorrhoid is. Unfortunately, I have one right now. Not the greatest.
Damn.
I started back at the gym, was eating a lot of protein and wasn't quite getting the fiber that I should. Using too much strain, it just sort of presses all that blood flow down into those veins and they balloon out. And if you're just constantly squeezing water out of your butt, from douching, you can balloon those veins out indeed. An anal fissure is actually a tear in the lining of the anal canal. And it can be just the very end where just the anoderm or the internal skin of the anus is cut open like a razor blade cut, like a paper cut, or it can be deeper and even go down into the muscle. So when someone has a hemorrhoid, they usually see swelling like a lump externally, or they can feel a lump internally. They may have rectal itching or pain or bleeding. For anal fissures, it feels like you're shitting razor blades.
I was going to ask you what the sensations, if there was.
Yeah. Yes, it's like you're pooping glass, basically, because that lining is so well innervated. When anything crosses a tear, it really burns.
I recently was wondering if I maybe had an anal fissure, and then after you said the two differences of like shitting glass, I'm like, okay, that's definitely ruled out.
How you get fissures, number one, either a very hard rapid exit, like a hard stool that is so wide when it comes out that it just tears your hole coming out, or a penetrative injury from anal sex with a toy or penis or whatever. That's because there's a resting anal tone there to keep things from leaking out of your body, at resting state. So you kind of have to allow your hole to relax for things to be able to open up enough to enter safely. Some things I kind of also want to talk about with fissures is things you might confuse them for. You mentioned hemorrhoids, which is great because hemorrhoids and fissures are often confused. And I think the numbers on the number of fissure cases per year in the US, which is 235,000 cases per year, is probably actually higher than that because a lot of people don't go seek medical attention. A lot of people are confuse it with hemorrhoids. A lot of us don't play with condoms anymore. So anorectal infections can mimic the signs and symptoms of hemorrhoids and of anal fissures. So syphilis, gonorrhea, chlamydia, those things can definitely cause a lot of inflammation down there and cause bleeding and pain. So make sure that you're getting your STI screens and not only blood tests and urine tests, but check where you play. So if you're a bottom and you ever have a dick in your ass, get a butt swab. If you suck a dick, make sure you're getting your throat swab for gonorrhea and chlamydia, because those things don't show up on blood tests. They're two very site-specific infections. Now, syphilis and HIV and those sorts of things will show up on a blood test universally. And if you just check a urine test for gonorrhea and chlamydia, you're only checking your urethral canal. You're not checking your butthole or your throat. That's another huge thing that I've made as part of my platform, is making sure people get checked where you play.
I have had my butt swabbed, and it was the easiest date I've ever been on.
Doctors even let you do it yourself.
Listen, doc, my healthcare is paying for this. You're doing it. Get back there. I made a joke when he put the Q-tip on my butt because it was like a centimeter up there. It was nothing.
And I was like, tell it.
I was like, that was the easiest dick I've ever taken. And my doctor's gay, so he was like, you're not the first gay to make that joke, get out. And it was just like, it was tired. It was a tired joke for him.
What's kind of scary though is like there are a lot of doctors who don't understand that part of testing, and because I made it part of my platform, I have people all over the country telling me, hey, I went to go see my doctor and he said that test doesn't even exist. And I'm like, your doctor is a moron.
When is it time to go to the doctor? If you feel like you're pooping glass, it's definitely not a hemorrhoid. When is it time to go to the doctor?
If you have 10 out of 10 pain, go to the doctor. You know, if it's severe pain.
What about 7 out of 10 pain?
Well, you know, I think that's up to the individual. You know, you could try to give it a day or two and see if it gets better. But if it doesn't get better, you need to seek medical attention.
Would you go directly to a primary doctor and then get referred to a GI, or would you just go straight to a GI if you could?
Most insurances require primary first, or they go to urgent care or whatever, get checked out. As GI doctors, we can help diagnose, but when it comes to the surgical and more invasive injection therapies, it's a proctologist, a colorectal surgeon who would do that. You're in severe pain and you can't sleep and you can't work, go see a doctor. If you do go for a surgical consult for hemorrhoids or for an anal fissure, talk to your doctor about how important anal sex is to you. Critical that you don't hide that, because some surgeons do procedures not thinking about that, like a stapled hemorrhoidectomy, and then it's almost impossible to take a dick after that. So talk to your surgeons about something that's going to help your sex life stay as it is or get better rather than go backwards.
You're really hitting a real topic, because like that's why I have a gay doctor now. For the first time ever in this last year, I started seeing a gay doctor. I got more vaccines than I've ever gotten in my life. I've gotten more tests done than I've ever gotten in my life. I get asked all the questions. Even though I'm married, they still ask me, I don't care that you're married. How many sexual partners have you had this year? Like, they understand our lifestyle.
They understand. Yeah.
So it's really nice.
Hot thing right now for people who have high risk sexual encounters is doxypep to prevent gonorrhea, chlamydia, and syphilis. More syphilis than chlamydia, but that's becoming a big deal now in our community to help stem off the rising tide of STIs.
If I have an anal fissure, can I bottom while I have one, or should I wait until it heals?
I usually recommend for someone to allow it to heal, because you don't want to increase the chronicity of it. If they don't heal with these conservative things, the next step is surgery. And surgery is really successful, but surgery sometimes can have long-term side effects. I've had people who told me that they bottomed like a champ 10 years ago, and then they had an anal fissure and then had a fissure surgery and ended up not being able to bottom anymore. And it really ruined their sex life. I like to try to save it as last resort, but sometimes if someone's that chronically injured, or if it keeps happening at the same spot over and over and over again, that's when surgery is indicated.
Yeah, it's like trying to do sprints with a broken ankle. Like you're going to end up having a broken knee next.
The same thing I tell people with hemorrhoids. If your hemorrhoids are just a little bit juicy and not bleeding and not painful or inflamed, but just a little bit present, you can absolutely bottom if you have hemorrhoidal tissue. But if you have bleeding, painful, irritated hemorrhoids, you don't want to go and bottom with that, because it's just going to hurt. Never use anal lubrication that has numbing solution in it, because numbing creams can decrease your ability to know if you're getting injured or not. I know chemsex is getting more and more popular with people. When you're chemically altered, it decreases your ability to feel when you're getting injured, especially in more extreme things like fisting. That's a high risk activity, and you really have to be with it to be able to safely do that kind of thing. People can make their own decisions, but I recommend avoiding really heavy chemical activity if you're going to be doing that kind of stuff.
I did a video about how to relax while bottoming, and I brought up poppers towards the end because I never, ever recommend using them to loosen up. Right. But I'm also not going to be able to stop people from using them.
Yeah, exactly. And people are going to use them.
Yeah, they're going to use them. But it's the same reason that you just mentioned. I always am like, use them when you know that you're loosey-goosey, everything's feeling good, you're a-okay, and then sure, go to town on it. But to use it as a prevention or to loosen up to begin with is the wrong thing to do, 100%.
I just wanted people to be aware, especially of the spray version, very, very dangerous. So be careful with the spray ones.
Yeah, I'm super grateful you brought that up, because I actually did not know about the spray at all. I've never even seen that. People that have had an anal fissure, what is the best way to heal one, and how long does that typically take?
Yeah, it varies on the depth of the injury, your overall health, any previous injuries that may have happened there. But generally, if it's your first time having an anal fissure, you're going to, number one, make sure that your stools are soft so that you're not adding to the damage by passing a hard stool over a tear already. You're going to want to maybe use a sitz bath to help soak your hole for about 20 minutes, about 3 times a day if you can. Usually people require a medication ointment to help increase blood flow down there, because when you have an anal fissure, what happens is your anal sphincter, your internal anal sphincter, spasms really tight because of the injury. And when it spasms like that, it decreases blood flow to the fissure and it delays healing. 2 topical medication ointments are diltiazem and nitroglycerin. Those increase blood flow to the affected area. Now, nitroglycerin can give you really bad headaches, so a lot of people don't tolerate that very well. Diltiazem is a little bit better tolerated, but I don't think it works as well as nitro. And the other thing that's kind of a hot new thing in the last 5 years is Botox injections. So if your hole is really tight and spasming because of a fissure and you want it to be able to heal, you can go to a proctologist and have Botox injections placed around there to paralyze the muscle just enough to relax it, not so that you're losing everything out of your bowels.
I love that you brought up the Botox, because that was actually a very interesting question I got that I was excited to ask you about. They actually called it hole tox, which I thought was iconic. Can hole tox prevent anal fissures?
I don't think there's been any studies to verify that, but theoretically, yeah. I mean, if your hole is relaxed a little bit more, especially if you have a really tight hole to begin with. I mean, I've tried to top a guy before. I tried to stick my finger in his ass, and I couldn't even get my pinky in his ass because it was so tight. And that just it wasn't going to happen. That's the kind of person who's going to benefit a lot from Botox injections, because it's going to relax that sphincter and allow penetration to happen.
For anal sex, prevention is learning how to relax your sphincter and learning how to ease in and letting go of those expectations that you see in porn where they spit on a dick and just shove it in. Like, that's
exactly. That's not reality. And then, you know, for the non-sex related ones, it's fiber and keeping your stool soft so that you don't have to strain so hard to push something big through there.
We just talked about relaxing and all that, and then fiber for your diet. But is there any other tips you have for prevention?
Well, I think, you know, lubrication is really, really key. I prefer silicone lube for penetrative anal sex with a penis. For toys, obviously, if they're latex, so you're going to use probably more water-based, depending on the quality of the toy. I have that technique that helps open things up called the butt clock. And it's basically, if you think of your hole as a circle, the external sphincter is made out of skeletal muscle so that you can control it with your mind. You can clench it and release it like a natal Kegel exercise, or like if you're going to the bath, if you need to go to the bathroom, you need to hold on to it, you kind of clench down. That's you using your brain to control the external sphincter. The internal sphincter, however, is not controlled with your brain. It's made out of smooth muscle. And a way that I teach people how to dilate it open is gently slide a finger in about 2 inches and press over laterally, 3 o'clock or 9 o'clock, 6 o'clock or 12 o'clock, and hold firm pressure there. Not painful pressure, but firm pressure for about 30 seconds. And then move around to the different positions. That tiny little hole starts opening up over time, and it's kind of like a key. It just unlocks your anal sphincters so that you can allow penetration to happen. And it's revolutionized a lot of people around the world's anal sex lives. I have people say, hey, thank you. I'm a woman from Sweden.
Hey, do you want to talk about the Swedish people?
And I tried your technique, and my husband can't get enough.
Iconic. I swear by your butt clock technique. I talk about it literally every week, every single week. I have multiple YouTube videos where I've shouted you out in it. When I found out about your butt clock technique, that changed my sex life. And
cool.
I was like, wow, I had been bottoming for 13 years, and like all of a sudden it was better than ever. And my partner, he has a really large dick. I actually did a YouTube video on bottoming for big penises, and everyone's like, oh, so lucky. I'm like, no, there's a lot, like, you don't know.
I actually had a guy this past week on my Instagram. Hey, I have a girthy 7-inch diameter cock, and my boyfriend's having a lot of problems taking it.
No shit.
They said, we've been trying your butt clock technique, and that's helped some, but it's not quite enough for him to take something that big. What do you suggest? And I talked about gradually increasing girth toys. I have a toy myself that has a small head shaft as it goes down, gets thicker and thicker and thicker. Wow. So as you slide in, you open up.
Oh.
Another way is I tell people this: if you're bottoming and you're going to take a big cock, sit on it first.
Yeah.
Take your time and slide down slowly until you feel comfortable. You don't get hurt. You don't have someone jamming it in you. You're in full control. And once you get all the way down on it and relaxed and can take a few nice deep breaths to calmly relax yourself, you can proceed to other positions.
I think a lot of people, when we like share all this information, they get really overwhelmed. I'm like, listen, if you're feeling overwhelmed, you just need to start with breathing, because I think you're not breathing right now. That's why you're getting overwhelmed right now. I swear, if anyone takes anything today, it's that butt clock technique. I talk about it every week.
No, that's so cool.
Yeah, and I always shout you out. I promise. All right. So I think that the last question is that psychological one.
Sure, let's go for it.
It comes from a hetero woman who loves anal play, and she has had multiple anal fissures now. They've all been healed up. She's good to go now. However, she's terrified to get back into bottoming. So if there was any advice you had on getting over that fear?
Yeah, no, I get this kind of question from a lot of people because people have had different kinds of anal rectal surgeries. People with ulcerative colitis may have had their colon taken out, and now they just have a tiny little pouch down there as a new rectum, and they're kind of terrified to put anything in there. And I tell people, explore with your fingers first. Feel around and see how things are going. Start with small toys. Start small and work your way up. Use lots of lubrication. Use lots of patience. If something doesn't feel right, then back off of it.
I am so grateful that you took the time to chat with me about this today, because I just get asked about it all the time. It feels like all the time when I talk about hemorrhoids or loosening up or anything, 10 out of 10 get an anal fissure question. And I just really wanted to go to you, the pro, about it, so that people aren't getting the fake science, the fake TikTok bullshit. They're getting it straight from the actual booty doctor, Dr. Carlton.
Oh, thank you.
Yes, thank you.